Hello, my name is Christopher Soria, and today we're going to be talking about which is the most common communication challenge during the medical care process and how would I solve it. The most common communication challenge during the medical care process is not only the use of medical terminology, but the gap between what the doctor thinks they explain and what the patient actually understood. In a consultation, the physician may believe that the diagnosis, treatment, and recommendations were clear, but the patient may be left with doubts, fear, or an incomplete idea of what they need to do. This happens because medical care is often full of information that can be difficult to process, especially when the patient is worried, in pain, or receiving a new diagnosis. For example, a doctor may explain that a patient has hypertension and needs long term treatment, but the patient may only understand that they need pills for now. If the patient does not understand that hypertension can cause silent damage even without symptoms, they may stop taking the medication when they feel better. This challenge is important because misunderstanding can directly affect treatment adherence, patient safety, and trust. A patient who does not understand their condition may not follow the treatment correctly, may ignore warning signs, or may not return to follow up appointments. As a medical student, I think this is a very important issue because being a good doctor is not only about knowing diseases, but also about making that knowledge useful for the patient's real life. And the suggestions and my plans to solve it would be to explain information in a way that connects with the patient's daily life. Instead of giving only technical explanations, I would relate the diagnosis and treatment to situations the patient can understand. For example, instead of saying only, you need to control your blood pressure, I would explain, even if you feel fine, high blood pressure can slowly damage your organs, so the medication is meant to protect you before complications appear. My second suggestion would be to organize the consultation around three basic questions. What do you have? What do you need to do? When should you worry or come back? This would help avoid giving the patient too much information at once. At the end of the consultation, I would summarize the most important points so the patient leaves with a clear plan, not just a prescription. I would also use the teach back method, but in a respectful way. Instead of making the patient feel tested, I would take responsibility for the explanation by saying, I want to make sure I explained myself clearly. Could you tell me how you are going to take the medication at home? This would allow me to detect confusion before it becomes a real problem. Finally, I would adapt my communication to each patient. I would not explain things the same way to an elderly patient with multiple medications, a young adult with anxiety about a diagnosis, or a patient with low health literacy. My goal would be for the patient to leave the consultation not only informed but capable of making the next step correctly.